So what is the number one fear I hear about cataract surgery? So number one is that it's going to hurt, or number two is that it's going to be scary. So I'm here to tell you that it is not painful and it's fast and easy. So in the time that it takes to wait in line for a latte at Starbucks, which is about 10 minutes, we can actually replace the cloudy lens inside your eye and dramatically and permanently improve your vision. Hi everyone, I'm Dr. Todd Driver, a board-certified cataract surgeon in Irvine, California. So for me, cataract surgery is routine. I've done it thousands of times, but for you, it's a big moment. And usually, what makes it scary is not the result, but it's the unknown. So today, I'm going to walk you through what happens step by step so there are no surprises. So before we go any further, one quick definition. A cataract is when the natural lens inside your eye slowly becomes cloudy, basically like when the lens of a camera gets cloudy. Cataract surgery simply removes that cloudy lens and replaces it with a clear artificial one. Now, let's talk about how we can do that comfortably. The most common question I hear is, does it hurt and will I see you coming at my eye with a knife? The answer to both is no. It is not painful and you can't see what's happening. So we use twilight sedation, which is the same level of sedation as a colonoscopy. So you are awake but deeply relaxed, and most patients drift in and out of sleep, remembering very little. You breathe on your own and don't need a breathing tube. And when it comes to numbing the eye in modern cataract surgery, there are no shots. Just a few drops numb the eye within seconds. And once you are comfortable, we begin. A lot of patients worry that they're going to see the actual surgery taking place. You don't. The microscope light is very bright and very close to your eye, so your vision is filled with light. Most patients describe seeing soft, shifting colors, mostly blues, pinks, and whites. And I've had some people say it actually looks like a kaleidoscope or like a pleasant psychedelic experience. Honestly, most people say it is a beautiful visual experience. Now, let's talk about the surgery itself. First, I make a very small incision at the edge of the cornea, which is the clear front surface of your eye. It's about 2.4 millimeters wide, which is smaller than the tip of a pen. Because it's so small, it seals on its own and no stitches are needed. Next, we remove the cloudy lens. Using advanced, gentle sound waves, a tiny instrument carefully breaks the lens into small pieces and removes them safely through the small incision. This allows us to perform the surgery in a minimally invasive manner. Now comes the most important part. The new lens is about 6 millimeters wide, but the incision is only about 2.4 millimeters wide. The way we get the new lens inside your eye is by rolling the implant like a burrito and placing it into a small injector and guiding it into your eye. Once inside, it slowly unfolds and settles into its natural position. I make sure the lens is in its proper position, and that lens becomes a permanent part of your eye. It will never form another cataract, and if a thin film ever develops behind it later, we can easily treat it with an in-office laser procedure. And then I say, we're all done. Almost every patient responds by saying they didn't even know it started. We then place a clear shield over the eye, mainly to prevent rubbing while you sleep. You sit up, you get some juice, and go home to rest. Your vision will be foggy at first, but by the next day, that fog usually starts to lift. I tell my patients it's like taking brown-colored sunglasses off after wearing them for decades. Within a few days, vision is typically much sharper than before surgery and colors much more vibrant. If you've been putting off cataract surgery because you were afraid of the process, I hope this helped take away some of that fear. I'm Dr. Todd Driver here in Irvine, California. If this was helpful, please like and subscribe for more eye health content. I'll see you in the next video.